and I'd like to show you how to read an MRI of the knee. This is just a random case. I figured just a random case may be as good as any instead of a normal one, and show you really how you go about reading a case and then picking up some findings. So this is a view I like to start with in every knee. I'll start on an axial view, and an axial view slices through the knee like bread. So let's say you're above the knee joint, you go down through the knee joint in short axes. It's just like you think of each slice as a slice of bread, and the loaf is the leg. And so if we get up above the kneecap, we see this dark band. This is called the quadriceps tendon. All the thigh muscles attached to this. Here's a thigh muscle here, here's another one, and they all attach to this thick black band called the quadriceps. And the quadriceps comes down and it attaches to the top of the kneecap, the patella. And if we go down below the kneecap, it turns into another tendon here, or attaches to this other tendon called the patellar tendon. And we'll see that from another angle here in just a minute. But when we see the patella, we look for a couple things. Number one, the morphology. Is it roughly equal on the lateral side and medial side? Does it have cartilage along the back of it that's normal in thickness? Are there any bone erosions or spurs? And in this case, we have cartilage along the back. It looks a little bit thin along the very front of it here. This is called the patellar apex, and this is the medial side, the medial facet, but just minimal, not even worth mentioning. And here's the lateral patellar facet. This is pretty normal in thickness, the cartilage over here. Now the patella glides along in this big bone here. This is the thigh bone, or the femur. And the femur has cartilage on it too. This is the articular surface of the femur. This is called the trochlea. And it makes a little V. And normally patients have a fairly deep V, and the patella sits nicely in there. This patient has a relatively shallow V. We call that a shallow trochlear sulcus. But the alignment is normal. It's right where it should be. And if we look along the medial side, there's a little band over here. This is called the medial patellar retinaculum, and we have another one over here. This is the lateral retinaculum. And this keeps the patella straight. It doesn't pull too far one way or the other. And when I'm done with the patellar, this view to look at the patella, I switch over to a side view. This is called a sagittal view.